What's up, guys? This is Dan from Fitness Pain Free. I'm a physical therapist. We're here helping coaches and clinicians troubleshoot pain and injury in the gym, getting folks out of pain and back to training, okay? So in the last few videos, we talked a lot about how to modify the bench press with shoulder pain. In today's video, we're going to talk about adding some extra rehab exercises so you have a nice comprehensive physical therapy program so over the course of time you continue progressing, okay? So as I talked about before, step one, you need to find modifications for the bench press and any other painful motion within the gym, okay? Step two is going to be applying a solid and comprehensive physical therapy program for the rest of the shoulder, okay? So for the majority of pain problems in the gym, I think we're often dealing with some sort of rotator cuff related pain and or biceps pain. We also could be dealing with some sort of problem at the pec, so let's say a pec strain, and or some sort of AC joint pathology, okay? So when I'm choosing exercises, there's 4 different exercises I like to keep into the program, okay? Or types of exercises, we'll say. In terms of frequency, I like to do this 3 times per week, so think about a Monday, Wednesday, Friday. In terms of sets and reps, somewhere between 8 and 12 repetitions, okay? So 2 to 4 sets, 8 to 12 repetitions. Obviously, there's going to be some variance based on the person and the movement as well, okay? So the first group of exercises I think you need to include with rehabilitation for folks that have pain in the bench press is going to be something to target the infraspinatus, some sort of external rotation exercise, okay? Now, if you want to learn more about how the external rotators work in the bench press, I'll leave a link here. I did a really long podcast episode on this. I'll put a link in the show notes so you guys can check that out, okay? But basically, when you bench press, here, you utilize your pecs and your delts a lot, right? Here's the thing, within the shoulder joint, if your pecs and delts are super active, so let's say this is the socket and this is the ball of my ball and socket joint, those muscles are going to try to pull the ball anteriorly or forward in the socket, okay? And that's not what we want. So what happens is that the musculature on the back side of the rotator cuff, the infraspinatus, has to fire aggressively with equal force as the pecs and the delts to pull that ball back in the socket, right? Rotator cuff provides dynamic stability. That's how it works with the bench press, okay? So the infraspinatus is also one of the 2 most injured muscles in the rotator cuff. So if you look at some of our medical literature on injuries to the rotator cuff, the 2 most injured tendons are going to be supraspinatus and infraspinatus, all right? So the bench press is going to really stress the backside of the rotator cuff, all right? And it's also likely to be the most injured tendon. So we want to make sure that we get it nice and strong so we can handle those forces when we bench press in the future, okay? So what kind of motions are we talking about? Well, the first one, and the most boring, but probably the most important, is going to be some sort of side-lying external rotation, okay? So from here, I'm taking a towel underneath my arm, just like so, okay? I'm gonna try to stack my shoulders on top of one another. My hand can support my head. Have my hips stacked as well. I allow the dumbbell to come down to my stomach, and then right back up again through a tolerable range, okay? Now, I know this exercise is super boring, but it's one of the best isolation exercises for infraspinatus. If that's the tendon that's causing you the pain, then we're putting the medicine in the exact right area, okay? As your patient gets better over the course of time, I like to do external rotation exercises with the elbow a little bit higher. Because if you think about a bench press, we don't bench press like this, right? We bench press like that. So I'm more specific to that angle by doing my external rotation work here, okay? And lastly, you can also do something like a band 90-90 external rotation where the band is pulling back here and I'm just flipping back against resistance, okay? So sideline external rotation, some sort of side-sitting external rotation, and or some sort of 90-90 external rotation should be part of your program, okay? The second type of movement I like to incorporate is something for the supraspinatus or top portion of the rotator cuff. Now, I think this is probably a little less important than infra, but it's also very, very active when you do pressing exercises, particularly overhead pressing, okay? And the movement that's going to target this the best is going to be scaption, okay? Basic and easy. So you start with 2 dumbbells, pretty light. We like to go thumbs up. The reason being is because thumbs up has been shown to have better EMG for the supraspinatus, and we're trying to put medicine directly there. We also want to have our arms a little bit out from the side, here-ish, 20-30 degrees. This is what's called the scapular plane. It's a little bit nicer on the shoulder joint. And all we're doing is sets and reps just like here, okay? Now, over the course of time, if you want to make this more challenging, we can also add some more load, we can add some more speed. You can also incorporate different exercises that are similar. So something like a lat raise to the side is a phenomenal exercise. I also like front raises here, right? And you can also do a lot of cable work. So let's say that I have cable cross. The cable is right here. I grab the cable that has a handle right here, and I can do my lat raises to the side just like this, all right? So those are a couple exercise ideas for the supraspinatus. The next area they want to target a little bit are all the rowing muscles, because we want to make sure we build a little bit of balance within the shoulder joint, all right? So my favorite is going to be some sort of seal row. So what you do is you take an incline bench, right? It's also called a chest supported row for obvious reasons. And then you have your dumbbells. These are a little light for me, but I'm not that strong. So the chest is supported, and from here, I reach down towards the floor and row straight back up again, all right? Now I actually like chest supported rows, but you can use any type of rowing exercise that you really like. So a cable row would be fine, bent over row, barbell, dumbbell, single arm rows, all good variations that you can give a shot, okay? Now the fourth group of exercises I like to focus on are going to be some sort of fly variation or something for the pecs. Now I know what you're saying. In the social media world, there's a lot of information out there saying that you are too developed in your pecs, okay? And because of that, your posture is like this, right? And that's the reason why your shoulder hurts, okay? Now, I don't know if this is the truth. If you look at research on posture and its relation to pain, it's all over the place. So I'm not going to open up that can of worms. But suffice to say, your major mover in the bench press is going to be the pecs, it's going to be the delts, okay? For a lot of other areas in our body where we have injuries, so let's talk about the hamstrings, let's talk about the adductors, let's talk about the Achilles tendon. If we apply a strengthening program to that area, it reduces your risk of future injury, all right? Why wouldn't you do the same thing for the shoulder? If people are getting hurt bench pressing and the major muscles that get kind of irritated are the cuff as well as the pec, why wouldn't we try to strengthen the cuff and the pecs to reduce the likelihood of injury in the future, okay? So the exercise I like, one of the ones that feels most friendly on the shoulder, because you have to be a little cautious with these, is going to be a cable crossover pec fly. So basically I have a cable set up here, cable set up here. I like to have the pulley coming down a little bit lower than the shoulder. I feel like this is a little bit nicer on the shoulder if you come from here as opposed to coming straight up from here. And I think that's also nice about this is when you bench press, we don't bench press the bar to our throat, we bench press it down to our chest. So if that's my angle for my fly, I'm getting that angle a lot stronger, okay? Also a big fan of doing one arm at a time. If you care about the development of your pec muscles, this is a phenomenal one for that. You get a great pec pump for that. And the other exercise I like that's actually quite weird that I like that kind of trains this fly position with the pecs is scaption, but in supine, okay? So you basically take a bench, put it to flat. I'm gonna have both of my dumbbells. I'm basically gonna do this motion right here. So it's kind of like you're doing a fly, but you have your thumbs meeting together in the middle, okay? And the reason why I like this is when you bench press, it's kind of the same exact thing that goes on the shoulder. So if you just take dumbbells and do this, you're training that pattern a little bit, okay? So let me show you a few. So we're laying back down here. Have my weights here. Thumbs are kind of facing up. Coming down at about a 45-degree angle. Going as deep as the shoulder tolerates, and then right back up, all right? Really funky fly variation, but very effective as well, okay? So, just to recap, shoulder pain during the bench press. Make certain first you modify the bench press so it's tolerable, okay? Taught you how to do that previously. Second step, apply a strengthening program to all the structures that may be irritated. So you're gonna pick an exercise from one of those buckets on each of those days. So think about your Monday, you go in, you do your workout, maybe it's upper body, you modify the bench press. At the end of the session, you do some sort of dumbbell external rotation, so maybe that's a dumbbell sideline external rotation. After that, you do some rows. After that, you do some flies, and then you finish with some scaption, okay? That would be your day one. You do the same thing on Wednesday and Friday, okay? So guys, that's it for today's episode. That's not it for the learning, so if you're a coach or a clinician and you want to learn more about troubleshooting pain and injury in the gym, highly recommend you check out this video right here to continue the learning. Once again, my name is Dan Pope. I'm a physical therapist. I'm helping folks help their patients get out of pain and back to training, all right? I'll see you on the next video.